Okay, a bit of a gear change. Let's see how St John Ambulance's equipment and procedures have improved moving people safely. You might have seen a mannequin around earlier on. We thought someone was being carted out of here before the event even started, but no, there's a demonstration happening. We're going to look at what's changed over the past 5 years and what's coming next, plus a live demo. Please welcome Paramedic and 2003 HSR of the Year, Rob Curtis. Over to you, Rob.
Thanks, Miles. Appreciate that. Cheers. Alrighty. You know when a body's being dragged up on the stage for a presentation, things are about to get spicy, so. Thank you very much for the words of introductions there, Miles. They're very much appreciated. Ladies and gentlemen, if I asked you to think about what you believed is the biggest risk to paramedics and volunteers working on the front line in Australia, I would hazard to bet that your thoughts would turn to drugs, antisocial behaviour, assaults, and alcohol-fueled violence. Fortunately, or unfortunately, depending which way you choose to look at it, they actually make up a relatively small portion of the pre-hospital workplace injuries that we sustain here at St John. Manual handling related MSD injuries in the pre-hospital environment is the single greatest contributor to injuries amongst paramedics and pre-hospitalists. Today we're going to investigate a small portion of this problem and see what our HSR cohort and the organisation as a whole has been doing to combat this pretty significant problem. But firstly, my name is Rob Curtis. I'm a paramedic with St John and one of the many very busy health and safety representatives working to try and keep our patients and our colleagues safe on the front line. I have to say that I feel quite privileged to be standing here today representing both St John WA and representing health and safety representatives to a room full of subject matter experts in the field of occupational safety. So thank you all very much for the gift of your valuable time, especially right before lunch. When I'm not a paramedic, I am an active soldier and medic in the Australian Army Reserve, and when I'm not out there being a weekend warrior, as they call us, I'm a father of two little ones. This is my 5-year-old daughter Jasmine on the left here in the ambulance with me, and my 3-year-old son James on the right, who is busting out to some tunes at the moment, and that is my partner Mel in the middle with me. In my free time, whatever that kind of looks like, I'm still working towards my Cert 4 in occupational health and safety, so maybe one day I could be considered an SME as well, but not right now. I think it's important that we start with a bit of a disclaimer, a bit of a declaration of interest slide at the beginning here. St John WA is a non-for-profit organisation, and while we plan to utilise several pieces of equipment for demonstration purposes today, we have not received any monetary remuneration or preferential treatment from any of these brands. We simply hope that you will find today's demonstration interesting and informative. On that note, for those that are struggling to see the demo up here on the stage, because we are quite spread out, I do of course welcome you to either stand or move to a better vantage point. All right, I want to dive into this by asking everyone a question, and if you're feeling brave and willing, please feel free to participate through a show of hands. Do not worry, there is no singing involved in this one though. How many people in this room have fallen over in their life? Yep. So this could be a trip on the rug, a slip in the bathroom, or maybe a few too many mimosas at a WorkSafe conference in the morning, perhaps. You'll be happy to know that you are not alone. St John, WA paramedics and volunteers attend on average one fall every 16 minutes across the state. The majority of these people are calling an ambulance because they will need some form of help to get up, not necessarily because they've sustained an injury. This may be a lift to standing, where we can dust them off and they can go about their day. They may need a lift to get back into their mobility chair, or they may need a complete lift off of the floor because of injury, usually requiring multiple ambulance crews. 1 in 5 of these patients will trigger a priority 1 lights and sirens response from us. And many of these people will require further assessment and treatment at hospital, especially those over the age of 65 who are most at risk. These manoeuvres account for more than 150 of our injuries in the last financial year, which is roughly half of all of our total injuries company-wide. In fact, as you can see up here, lifting a patient from the floor and lifting a stretcher have consistently featured in our Big Six campaign since its inception in 2014. The number of MSD-related injuries sustained by St John WA workers has decreased pretty significantly over time, while our staff complement continues to grow. However, the number continues to remain far too high. As a result, St John has invested heavily in the past 5 years in the area of injury prevention to continue this downward trend. Good. I'm super excited to unpack this problem and demonstrate how manual handling makes up such a significant portion of our MSD injuries. And I'm even more excited to take you on yet another journey today through our evolution of making this really high risk aspect of our job safer without compromising patient care. To get started, I want to take you back to the pre-COVID times, the good old days as we now refer to them, where hand sanitizer, cough etiquette, and social distancing were yet to be discovered by Western society. It was a time where paramedics were, I must admit, less than amazing at utilising PPE for isolation precautions. And for those of you that are wondering, yes, that is definitely a picture of me from 5 years ago. Any resemblance to Brad Pitt is purely coincidental. So let's journey back 5 years ago. We are currently back in 2019, where we use sophisticated lifting equipment, such as one of these. This is a bed sheet that we get from the hospitals. The process of helping a patient from the floor to standing is not a terribly complicated one, but it's certainly not without risk. As you can see here, the process involves a bed sheet being placed around the trunk of a seated patient. The sheet then runs underneath the arms of the patient to provide a handle for our staff to utilise, and the patient has something to hold on to. After the sheet is in place, staff will chock the patient's feet using their own to avoid their feet from sliding out and slinging-shotting Katie off of the stage. The patient's knees are bent with their feet flat on the floor, which is usually easier said than done. And then finally, we give them some quick instructions on how we will lift them and what their responsibility is during the lift. Next was the manual task that you've just seen here performed by the paramedic crew to get the patient to standing. This process has the potential for multiple injuries to patients and staff alike, ranging from wrist, back, leg, shoulder injuries through to various other RSI injuries, especially those that are twisting related. This process alone was responsible for more than 70 lost time injuries to our staff over the previous 5 years. Let's have a quick look at the Furno 50 stretches, which were, oh, actually, I've forgotten to click a slide, haven't I? All right, good stuff. Let's have a quick look at the Furno 50 stretches, which were introduced into the ambulance sector around the world in 1978. They were top of the line at the time, with several updates being made to the various models. Up on the left-hand side of the slide here, you can see an original Furno 50A stretcher, which is currently a piece in our museum, in the Ambulance Museum of Belmont. The photo on the right and what you see up here on stage is the Furno 50E, a model that was released in 2004 and remains unchanged since then, and as you can see is still in use with us today. They are mechanical, manually lifted stretchers that weigh 49 kilos when empty and can easily weigh in excess of 140 kilos with a patient on board. This weight needs to be lifted multiple times a day by a crew of just 2 in light, dark, wet, dry, and often time-critical and stressful conditions, like up on a stage. The raising, lowering, and manoeuvring of these stretchers accounts for a pretty staggering 196 injuries to St John workers over the last 5 years. So something obviously needed to change. Any level of basic root cause analysis tells us our processes were no longer safe or sufficient. As an organisation, we couldn't afford to continue letting our staff weather these frequent injuries, and that is why in 2021, we embarked on a long and expensive road to update the equipment organisation-wide. We reviewed our lifting policies and our processes. We reviewed our training. We designed new equipment, and we spent millions on state-of-the-art powered equipment to tackle this issue. I think now is a really good time to have a look at some of the unique challenges to an update of this scale. Since 2019, our career operational frontline staff numbers have grown 26% and is now close to 1,700 staff members. Our volunteer cohort alone has grown a staggering 35% to more than 2,500 people. Our paid and volunteer staff are also geographically displaced all across Western Australia, and this highlights yet another pretty unique challenge for us. And that's that WA is big. It is very, very big. St John WA's jurisdiction covers the single largest landmass of any ambulance service in the world, covering more than 2.5 million square kilometres. The northwest of WA is the most challenging area of coverage due to the remoteness of many of the communities and the limited resourcing in the area. On top of this, and for the last 5 years running, the Kimberley region has the highest rate of falls-related hospitalisations in WA. So, with a staff complement comprising of both career paramedics and volunteers, located both here in the metropolitan area and in our regional country locations, some of which are as far away as 2,300 k's from our main headquarters, provides a very significant logistical problem for affecting organisational change, especially when our organisation and staff numbers continue to grow. So maintaining consistency of quality training has been exceptionally hard. On top of this, our ageing population means that more people are falling at home and in public places, meaning that more patient lifts are required. This, along with the fact that our society is growing in size, and unfortunately, I'm not just referring to numerical population growth. As a result, the increased workload and the increase in patient size makes it easy to see why paramedicine is considered a high-risk profession, but possibly not for the reasons most people have traditionally believed. Let's also not forget that we have been doing this over the last 5 years during a global pandemic. Let's fast forward to current day practice. Welcome back to 2024. In 2022, we designed and built a patient lifting belt here in-house. We looked at other off-the-shelf ideas, but nothing met the bespoke needs of our service from a safety and from an infection control perspective. So after several years of consultation and trials and development, we began production of these lifting belts. Similar in the mechanics of the bed sheet, but far superior. The belt has inbuilt handles on each flank to stabilise a patient, which the bed sheet did not have. It has longer weight-rated looped handles, which the bed sheet did not have. And it has a nice big strong buckle that fastens the patient to the strap. It greatly reduces the risk of patient injury and improves on the ergonomics of the lift to our staff. When combined with other bits of kit, such as the elk lifting cushion, which is being prepared by our demo right now, and you can see in the top right-hand side of the screen here, the bottom right of the screen if you've got the slides, we can massively reduce the amount of work required to complete these high-frequency tasks. This device is a fantastic bit of kit, and we are going to talk about it a little bit more in detail later on. But essentially, it is an air pump that connects into a lifting cushion. The lifting cushion has 4 individual segments, and what we will do is we'll stabilise the patient, and we can inflate each of those cells individually, which will take our patient from the floor to a seated position. Also in 2021, St John embarked on fixing the issue of the stretcher-related injuries, recalling that figure of 196 injuries from before. This was achieved with the introduction of the new advanced stretcher called the Striker stretcher. It is a battery-powered hydraulic stretcher that can lift a maximum of 318 kilos at the push of a button and has almost no manual handling involved at all, which is very handy with that growing population issue that we discussed before. It was predicted that the retrofit and rollout would take about 5 years to reach every ambulance in the WA fleet. However, in the first 12 months of having, In the first 12 months of having a mix of these Striker Inferno stretchers on road, we noted such a significant drop in injuries that the entire rollout was fast-tracked. All of our additional resources, apologies, I've lost my spot again, were dedicated to this project. As a non-for-profit organisation, we spent more than $11 million on buying new ambulances, purchasing the new equipment and hiring more staff during a labour shortage to retrofit our pre-existing ambulance fleet to get these out as soon as we possibly could. As I'm sure we can all remember, we had significant issues with the global supply chain shortages over the last few years. If you can remember how difficult it was to get a packet of toilet paper a couple of years ago, imagine trying to compete for things like PPE and ambulance stretchers during COVID. Despite these difficulties, our 5-year rollout reached 100% completion in the Perth metro area in July of 2024, just under 2 whole years early, with the remainder of WA's country locations expected to be completed by the end of the year. I must admit at this stage, I find myself reflecting back on Jodie and Wendy's talks earlier today, where they referenced top-down leadership. So I can proudly say at this point that this is a project that is a fantastic example of getting this right. The project was completed at a cost of more than 150% of the original budget, but we predict that this early rollout has prevented nearly 100 lost time injuries in the 2-year period that we got these out earlier, plus the countless injuries that they will save us in years to come. The elk lifting cushion, which we've just seen in action over here, alongside the lifting belt and the power stretchers, have been invaluable tools in reducing injuries. One of the limitations to its utilisation currently is that they are only available on request of the crew and are only carried in our single response cars. St John WA is currently in the process of engineering the mounting and charging facilities so that every ambulance in WA will have one of these on hand. This project has been aptly named Elk on a Shelf, and we hope to see the rollout and completion of this body of work by Christmas 2026. We've also looked at other options to eliminate the need for patient lifts as well. The Razor 2 chair that you see up here is a fantastic substitute when the elk lifting cushion is not appropriate due to the patient's disability or injuries. It is lightweight and it can be assembled around the patient without the need for them to mobilise or be rolled. The Razor 2 chair and several other pieces of equipment are carried on our custom-built ambulances called the CPAT truck, which is designed to assist crews with difficult and complex patient moves. This is the CPAT truck. It stands for the Complex Patient Ambulance Transport Truck and has been custom designed and built here in Perth to aid in the transport of bariatric and complex patients. The vehicle is equipped with multiple specialty items to prevent injuries to paramedics and safely move patients from where they are to the care facility that they need to be. Some of the unique equipment that is stored in this vehicle include the hover jack and the hover mat seen in the top right-hand corner of the slides here. Both of these utilise a powered air pump to inflate and can assist with paramedics to move patients where they need to. The hover jack is similar in operation to the elk lifting cushion, but it's the same size as a single bed. So patients with significant injuries, such as leg fractures, don't need to be moved or lifted even, reducing discomfort improving patient outcome, and being much safer to our staff. The hover mat, which is the white piece of kit you see on the right of the slides, is a fantastic piece of equipment. It has thousands of tiny holes on the bottom side of the mat. When a patient is placed on top of this inflated mat, the air escapes through these tiny holes and the patient can be slid around on the ground in a similar fashion to a hovercraft, greatly reducing the friction and therefore the work associated with the move. The CPAT track also has one of these razor chairs and bariatric wheelchairs to assist with patient extrication. The issue is, of course, the cost associated with building the vehicle, purchasing and maintaining this equipment, and is currently only available here in the Perth metropolitan area. However, their availability is expanding as more of these vehicles come online. There is no off-the-shelf design, and every ambulance service in the world is faced with a similar predicament. Okay, let's quickly dive into the future with the 4 minutes that we have left, and have a look at what we hope will be the next iteration to safely move ill patients while keeping our people safe. We have spent a considerable amount of time in consultation with both Ambulance Victoria and the South Australian Ambulance Service to explore how they have tackled this issue. Through the generous sharing of lessons learned and training materials, we have been able to duplicate their training program and the procedures of our friends in the East. Their solution was actually really ingenious. It was elimination. They found a way to safely move people that have suffered a fall or a medical episode to the ambulance stretcher without the need to conduct a traditional patient lift, eliminating a significant portion of the risk to our staff. As you can see here, the crew have fastened our spinal board to the end of our stretcher and are in the process of placing a patient on a slide canvas, which is behind me. Good stuff. Okay. Ready when you are. Alrighty. The patient is then slid across any surface and almost any distance towards the stretcher. We utilise the ramp we created earlier to quickly and safely get the patient loaded and ready for transport to hospital. We envisage that the complete organisational rollout of this training is still some time away. However, based on the data from our friends at Ambulance Victoria and South Australia, we believe that more than half of the number of patient lifts can be avoided and therefore the injuries each year from its introduction. We hope by 2030 to see our lifting related injury numbers drop from 150 in current day 2024 to less than 40 in 2030. In summary, do you remember the Big Six campaign that we spoke about at the beginning? These new initiatives and processes have been effective in effectively wiping lifting a stretcher completely from the Big Six since the introduction of the Striker stretcher. Our goal is by 2030 to see lifting a patient from the floor also gone from this list. I think now is a really good time to reflect that every paramedic sustaining a lost time injury results in one less available ambulance to respond to our loved ones in the community at their time of need. We have lost too many amazing paramedics in the past to career-ending injuries, and it's to these selfless individuals that we dedicate this presentation today, and we give our thanks for their service. Ladies and gentlemen, thank you so much for the gift of your time today. I would like to ask you to help me thank my amazing and quite brave crew for what they've done for us today. I'll introduce you to them. Katie Tran, our OSH advisor. Katie, come on up. I've also got Ben Mann, our OSH team leader. Thank you, mate. Cheers. This is not Ben, by the way. There you go, that's Ben. Well done, mate. Thank you. Next up, I have Taylor Paulwood, Paramedic and Health and Safety Representative for Black Shift North. Come on up here, you. You're not getting away with this. You too, Tick. In the interest of time, this is also Tick Riemann. He is a Paramedic and Health and Safety Representative for Black Shift South and is a finalist for the HSR of the Year Award at the Health and Safety Excellence Awards for 2024. So thank you, congratulations. Good stuff, mate. That's for you, cheers. There you are.
Thank you very much.
Good on you, mate, cheers. All right, ladies and gentlemen, I'm Rob Curtis. Thank you all so very much. And please, take it easy on the mimosas for the rest of the day and stay on your feet. Thank you.
Thanks, Rob. So many technological advancements, innovations right here in our backyard. That was a fantastic demonstration.
Thank you.
Are there any newly designed equipment that you can use between patient houses and ambulances when the access is narrow, or if there are stairs to negotiate?
Yeah, well, there is. So a couple of bits of kit that we have, that patient drag that you've seen, you can do in quite narrow areas, and narrow and tight areas is a specialty of ours. We do with it all the time. We've also got a piece of equipment that we call the stair chair. I think it's a Furno product from memory, which we can attach a track system to the bottom of, and it will allow us to safely descend a set of stairs with a patient on it. And it's quite a safe and a brilliant piece of kit. So every ambulance has one of those on it.
The thermo chair.
That's a Furno.
Furno. I was thinking of the thermo mix, but that's something very different.
The thermo chair.
Right.
That's it.
Okay, that's why I'm the MC and you're the paramedic. What is the weight rating of the lifting cushion?
Oh God. 450 kilos.
There you go. Someone with a very clinical question. How do you safely remove an unconscious person from a bed to perform CPR?
Oh, yeah, that's a hard one.
That's a hard one.
The answer is there is no great way of doing it. It is getting them on the floor as quickly as you can. So grab an arm, a leg grab, clothing, and it's a drag them on the floor. There's no nice way of doing this. Time is of the essence in those situations. So yeah, we just make it happen.
Thanks, Rob. Let's give him a round of applause. Appreciate it.
Thank you, everyone. Thanks, guys.